Now it's my pleasure to introduce the portion of our program where we honor the field's leaders. The Distinguished Investigator Award recognizes individuals who have made a significant and long-standing contribution to the field of health services research. These individuals serve as leaders and role models for the field. I want to thank Anne Marie O'Day, Chair of the Distinguished Investigators Award Committee, and the other members of the committee. Please join me in congratulating the 2017 Distinguished Investigator Award recipient, Dr. John Ayanian. Dr. Ayanian is the Alice Hamilton Professor of Medicine, Professor of Health Management and Policy, and Professor of Public Policy. He is also the inaugural Director of the Institute of Healthcare Policy and Innovation at the University of Michigan, where he leads the nation's largest university-based organization of health services researchers, which includes 500 faculty members and 17 schools and colleges. He was previously Professor of Medicine and Healthcare Policy at the Harvard Medical School. John is an accomplished health services researcher, producing groundbreaking policy-relevant research for more than 3 decades, publishing 233 peer-reviewed articles and 61 invited editorials and commentaries in high-impact journals, while receiving numerous national awards and recognitions. But beyond this, the award committee saw that John has made a substantial impact on healthcare policy and population health. So join me in congratulating John.
So Darrell, before I begin my remarks, can we be sure this Academy Award's meant for me and not for La La Land?
It's for you.
Thank you. So 19 years ago, I was on this stage to receive the Alice Hirsch Award, like my colleague Julia Adler-Milstein will receive for her accomplishments in a few minutes. At that time, I showed a photo on the big screen of my 3 children, who were 7, 5, and 2 at the time. We were planting our first vegetable garden together, and I reflected on the parallels between starting a garden and launching a career in health services research. Good seeds of ideas, rich soil for collaboration, and plenty of nurturing and patience to give good ideas time to bear fruit. Our kids are now in their 20s, and I'm honored to have my wife Anne and my daughter Caroline here to celebrate this special occasion with me today. I've had the privilege of plowing and harvesting the fields of health services research with superb collaborators at 2 great universities, Harvard and Michigan. I'd like to give special thanks to my esteemed colleagues, Eve Kerr at Michigan and Nancy Keating at Harvard, who nominated me for this award, and to 5 colleagues who contributed to the nomination. Arnold Epstein, who was my original research mentor at Harvard and got me started in this field, Rod Hayward, who leads the Clinician Scholars Program at Michigan, and 3 of my very talented younger colleagues, Amal Trivedi, Michael McWilliams, and Renu Tepernini. We meet today at a time of turmoil in health policy, as Darrell aptly described, with the uncertain future of the Affordable Care Act. When I started my first health services research project as a medical student 30 years ago, I had just finished a course on the plight of uninsured Americans. At that time, 30 million Americans were uninsured, and the number grew steadily to 48 million by 2010. In my clinical work as a primary care physician in Boston, I saw how uninsured patients struggled to pay their medical bills and often postponed or avoided care that could help them, and how these problems were relieved when Massachusetts expanded coverage in 2006. Most vividly, I remember my uninsured patient who was a hardworking, self-employed man feeling poorly with profound fatigue for weeks. When he came to see me a few months after Massachusetts health reform, his blood sugar was over 400. With help from my clinic staff, he enrolled in an affordable private insurance plan. His medications for newly diagnosed diabetes were covered within a day, and his blood sugar was well controlled soon afterward. Within a few weeks, he felt much better and was able to resume working and supporting his family with full vitality. Over the past 3 years, the Affordable Care Act has dramatically expanded coverage, and stories like my patient's experience have multiplied many-fold as over 20 million Americans have gained Medicaid coverage or affordable private insurance. At the University of Michigan, my colleagues and I have been tracking the experiences of the enrollees in the Healthy Michigan Plan, our state's version of Medicaid expansion that covers 650,000 low-income adults. Our Michigan team now has a growing body of quantitative and qualitative evidence, including a number of presentations at this meeting showing how Medicaid coverage has improved people's health, their financial security, and their quality of life. We are also excited to see at this conference what other research teams from around the country are learning about the effects of the ACA. As the fate of the Affordable Care Act hangs in the balance on Capitol Hill, the need for solid evidence to guide policy will remain strong, whatever direction health policy takes going forward. The rigorous research of many in our AcademyHealth community helped to make the case for Massachusetts health reform and for the Affordable Care Act. Our work is even more important now. I encourage all of us in AcademyHealth, both the researchers who produce new evidence and the decision makers who use it, to renew our focus on achieving a high-value healthcare system that meets the needs of all Americans, especially those who may be at greatest risk from any changes to come. And in closing, as I've always wanted to say, I'd like to thank the Academy for this award.